Dr. Blatz, I want to personally thank you for even taking time. I know you got to rush to the airport, but you know, the fact that I got to sit through your CE course, and it's rare. I'm a patient. I didn't go to dental school. I'm doing a documentary on all.
A very educated one now.
That's right. I'm a very educated patient, and that's our hope, is to help educate other patients.
Absolutely.
And so the one question I wanted to try to ask you before you scooted off and headed home was, you know, these patients, with all your experience, and it would literally take me 5 minutes to go through all your different accolades. I'm not trying to brag on you too much, but the homework I did on you, I'm like, oh my gosh, did this guy do anything other than go to school? I mean, he's an amazing, so I don't mean to blow you up on that, but one of the things I wanted to say was, you know, these patients, from somebody with your level of credibility, what would you give them as a nugget to ask during a consultation? They go into a consultation with Dr. Bob. Dr. Bob, they're sitting down. What should they ask Dr. Bob and make sure is one, not all of the questions, just one nugget that you can think of?
I mean, we talk a lot about materials and material selections, but I think it's more important that also, you know, the clinician, you could ask the question, hey, what materials are you using? Well, that's okay, there's one, but it's more important that the clinician and the dental laboratory are familiar with certain materials. So it's not so much one material over the other. It's much more, how does the clinician guide you through the process? I think that's one of the most important things. I want to see, first of all, they listen to my concerns if I'm the patient. Do they listen? And how do they guide me through the process? Will they give me an opportunity to try it out? For example, if I have full mouth rehabilitation, is there a provisional involved? Is there a mock-up involved? Or are they even doing like some of the digital smile design that we do now, where you can visualize the outcome beforehand? Because that will determine the material. It's not that I say, hey, I want this material or that material. The material selection is based on your specific situation. And this is what I want to see. You know, it's not that you're using this material, or you're a good dentist. No. It is, how do you make your selection? Do you make it based on my specific situation and guide me through the process?
Great point.
You know, and through digital smile design, and then mock-ups, and then provisionals, to then come to the ultimate conclusion, this is the best material for your situation. And that the clinician is familiar with that, and the dental laboratory works in concert with that. I think that is much more important than saying, well, he uses that material, that's why he's a good dentist. No, the materials are being selected based on the patient needs. And it's very different. Even though it may be the same reconstruction, you can use an acrylics, you can use zirconia, you can use titanium, based on your specific situation. And if you see a clinician that guides you through the process, logic is, listen, this is what we have. You have a very heavy bite, for example. We need to use something stronger than we use in this patient. This is what I would like to see. So it makes all sense for me, and that the clinician is focused more on my specific situation and not a preference of material that he may have or not have.
Welcome to the shortest version of the Smile Mentor, because I think that for you patients out there that are doing your homework, if you listen to what Dr. Blatz said, and we've seen those places that say we only do zirconia, or we only in monolithic, and or we only do this. That, wait a second, we're not one. I mean, you can't use a hammer and everything's not a nail. You have to have that customization to be able to not only know that they have a big toolbox and they know how to use that toolbox, but he's even talking about the concert between the lab. Ask them, how do they work well with their lab, and how are you going to treat me as a specific case, not just a nail? So remember that when you're doing your homework.
And that's what we pretty much teach, is what the whole day was about.
Yeah.
To show our colleagues how to make those smart decisions based on the patient's needs. Of course, also on the science that's available. So there's three parts of the selection of materials that I mentioned in the very beginning. There's, of course, the science that we have. If there's scientific evidence, you don't want to use any materials that are not proven. There is the expertise of the laboratory and the clinician as well. And most important, the patient's specific needs. That's what I make my decision on. And if you ask this question to the clinician, say, how do you make your selection of the materials? That's key.
That's it. Dr. Blatz, I mean, I had a whole list, and I know you just did such a good job teaching. I know I couldn't interrupt you on that. I'm bummed I didn't get to more of my questions, but that's a huge nugget. I want to thank you for taking the time.
Well, we'll have much more time available when you come visit me.
Okay.
The University of Pennsylvania, our dental school is open, and please do so, because then we can answer many more questions and show you also our facilities and how we approach cases.
You know, if that's an honest invitation, I'm going to take you up on it. Okay.
You better believe it.
Well, I guess I better tell our video team to pack our bags.
Of course.
Hey, Dr. Blatz, I really appreciate your
Very
time.
much so.
Thank you.